Well, we lead off with a CBC News analysis that is raising alarm bells about the risk for infectious disease outbreaks in some Toronto schools. Now, these findings show that more than 10% of students have exemptions from being vaccinated at 12 alternative schools. Alternative schools have much smaller student populations. Some of them are grade schools, others are high schools, but all of them are publicly funded. And with that, let's bring in Laura McQuillan. She leads off our coverage this morning with this story. So let's talk about health officials here. Why are they alarmed by these findings?
Well, they're saying that there are enough unvaccinated students in these schools to prompt an outbreak there if measles were to spread. They don't have that herd immunity that we talk about, where when enough people are vaccinated, it means that those who aren't vaccinated are protected as well. So that's part of the concern. And with this, we're talking about students whose parents have a religious or a conscientious objection to vaccinations, not medical exemptions, one based on their beliefs. And we in fact looked at immunisation data, our CBC News team did. Take a look at this. This is a map of Toronto's schools. We're talking 806 public schools, English, French and Catholic. You can see most of them green. That's where there's a high level of people being vaccinated there, but red means a higher level of exemptions. 10% or more of the students in those red schools have an exemption towards vaccination. Now, the highest exemption rate is at a school called Da Vinci School. It's got just 47 students. It is an alternative school, but of those 47, 17 students, 36% have exemptions for vaccinations. That's concerning to health officials here, and they say citywide it's just 1.7%. You can really see that stark difference. That 1.7, however, they say is still too high, could still lead to large-scale outbreaks. And we spoke to Toronto's Associate Medical Officer of Health, Dr. Vanita Dubé, about that herd immunity, why it's so important in schools, and here's what she told us.
It not only protects the individual students who are vaccinated, for example, but it also protects those children in the school who may not be able to get vaccinated, maybe because they're immune compromised, they're on chemotherapy drugs, and so they actually can't receive the vaccine. So it protects other people in the community who are who also can't be vaccinated, and that's why having high herd immunity rates is so important, and that's why we want to be able to get that exemption rate lower.
So obviously a lot of concern, as you say, as a result of these findings, but that's Toronto. Does this say anything about the national picture when it comes to vaccines?
Well, it's quite interesting when you look at Ontario as a province compared to some others. So Ontario, one of 3 provinces alongside BC and New Brunswick, which mandate certain vaccinations for school-aged children. So kids at school are required to have vaccinations, but all 3 provinces have exemptions like this for personal beliefs. In Ontario, parents have to undergo an hour-long education session on vaccines before they sign a statement saying they object to their child being vaccinated. Of course, their child can still go to a public school, as we are seeing here. In fact, right now, a group of Ontario mothers and an anti-vaccination group are suing the Ontario government, saying it breaches their charter rights to make them even go through this many hoops. Meanwhile, in New Brunswick, the government is moving to scrap that personal exemption. They say it's too risky to have people, opting out of vaccinations. When we're talking about 112 cases of measles in Canada this year, we've seen many more south of the border, some 1,200 this year. Really concerning stuff around the globe, to the point where the World Health Organization declared vaccine hesitancy one of its top global health threats for 2019. That's what health officials worry about here.
A global health risk, as you say, that now officials are once again looking at in this country. So thank you for that, Laura.
You're welcome.
Well, returning to our top story today, CBC News has learned some striking numbers about the rate of vaccinations in some publicly funded alternative schools in Toronto. A CBC News analysis finding that over 10% of students in 12 Toronto schools are not vaccinated because of parents' beliefs, and that could put their schools at risk of an outbreak. Well, with more on what this may mean, Dr. Isaac Bogosh now joins us. He is an infectious disease specialist at Toronto General Hospital, although we have to say that Dr. Isaac joins us from Ottawa today. So, Isaac, good to see you again. Good morning to you.
Good morning. Good morning. Thanks for having me on.
Now, listen, you look at these numbers, and I think there are things here that are going to shock people. We mentioned the 10%, but another number that this analysis found was that in one school, the exemption rate was about 36%. Are you concerned when you hear that number?
Yeah, absolutely. I mean, certainly that number is very concerning, and we know that it's no surprise that when the rates of vaccination go down, and when the proportion of people in a community are not immune to an infection, if that infection is then introduced to that community, it's going to spread like wildfire. And with infections such as measles, we know that if there's an introduced case, there are going to be lots of people exposed and infected with that infection. So it's certainly concerning when we see these thresholds of vaccine get lower and lower, especially in a school population where there's so many people in close contact with each other.
You use the word threshold, and I think that's interesting because we have talked about herd immunity before, but I think it's worthwhile to talk about that again. Explain to us this principle of herd immunity and how these numbers actually challenge the effectiveness of that.
Yeah, so herd immunity is a principle that when we think about an infection in a population, if we have a certain number of people in that population vaccinated and immune to an infection, if that infection is introduced, it's not going to spread around and be transmitted to other people. And imported infections will really have maybe 0 or 1 or 2 subsequent infections before dying out. It's not going to have a big outbreak. And the threshold, for example, for measles is about 90 to 95% of individuals should be immune to prevent something like that from happening. But when we see these the rates of vaccination drop in whatever population, a school, community, a city, a country, and when that infection is imported, we're going to see a large outbreak. And, we're starting to see that in 2019. So, for example, we're seeing historic outbreaks of measles in places that should not have it. So in many European countries, in the United States, we had a measles outbreak in British Columbia not too long ago as well. And these are completely preventable. Well,
preventable, as you say, but these are alternative schools in Toronto that really begin this discussion. But if you keep digging deeper, apparently 20% of parents, not just Toronto, but across the country, are vaccine hesitant. 20%. So that's well below the threshold you're talking about with measles at 95%. You need people to be vaccinated. So have public health authorities done enough here to address the challenge of vaccine hesitancy?
Yeah, this is an ongoing, certainly an ongoing issue, and there's not going to be a one-size-fits-all answer to this issue. We're seeing vaccine hesitancy here, of course, in Canada, but this is also a global phenomenon, and it's obviously a very challenging issue to combat. So, it's not going to take physicians or public health authorities wagging our fingers saying, get vaccinated, get vaccinated. This is clearly going to be a multi-pronged approach. We're obviously, part of the team is going to be physicians and frontline healthcare workers and public health providers, but it's also going to take a lot of community engagement and really working with local communities and all relevant stakeholders. And I think that really involves working with local communities and speaking, for example, with parents and members of the school to discuss what the issues are and what concerns they have. It also involves policy, and sometimes this might be at the level of the school board, this might be at the level of the city government, the provincial government, the federal government, but really we have to get all the major players at the table to really come up with a solution to help prevent the spread of infectious diseases in Canada.
Well, it's interesting you say that because, of course, there's this debate as to what type of exemption can you really extend, whether or not they need to bring back the number of exemptions that are available for parents out there. But we're talking about schools right now. But kids are not limited to schools. Kids go to community centers to access a swimming pool, to play basketball. Kids go to libraries. They go shopping in malls. Talk about the risk of not getting immunized and exposing others in these very public places to disease.
Yeah, absolutely. And therein lies one of the major concerns, because it is, of course, not just restricted to the individual that might get an infection. First of all, these schools have, maybe hundreds or even thousands of children who are densely packed together. So it's a perfect setup to spread an infection within a school. But of course, they live in a community. They live in a city. They live in a province, and they might be able. Infected individuals can bring these infections home. They can transmit the infection to younger siblings, or maybe an older grandparent who might be more vulnerable to these infections. So certainly it's not restricted to the school. It's a big problem for the community at large when we have pockets within the community that are not vaccinated, because there's many vulnerable individuals amongst us that are at risk for getting infected but having a more severe outcome. So it's extremely important to find these hot spots where there are lapses in vaccinations and work with the local communities and work with these individuals to figure out what's the issue. But essentially, we need to do better. We need to do better in these schools to ensure that the children are vaccinated, so that it protects them, but it also protects the community around them.
Mm-hmm. You know, I don't want to let you go without asking you to perhaps speak to anybody out there that is vaccine hesitant. And, you know, we have to acknowledge that parents, they don't pursue vaccines not because they want to hurt their child, but because they're worried that the vaccine is actually going to hurt their child. What do you say to them?
Yeah, I mean, these are it's a very challenging discussion, and I usually tailor these conversations to the individual. And oftentimes I do a lot more listening than talking in those conversations. And I really try to explore what their issues are, what is their concern, why do they feel that this potential vaccine might cause more harm than good. And I usually try to tailor my discussion to the individual concerns because it's sometimes rather heterogeneous. We like to lump individuals together and say, oh, these are vaccine hesitant individuals. But there's a remarkable diversity of opinions and concerns within that community. And it's extremely important to tailor the message to the individual concern. So it's tough to have a one-size-fits-all approach, and that's why we need multiple stakeholders at the table to really solve this issue.
Dr. Isaac Bogosh, thank you for that.
Thanks for having me.
And of course, Dr. Isaac, an infectious disease specialist at Toronto General, who joins us in Ottawa this morning.